Well, as you know, when people go for therapy, cancer patients, and they get treated by radiotherapy or chemotherapy, uh, the cells get killed. Not only not cancer cells, but normal cells as well. So we have a technology that allows us to detect uh, fragments from the cancer cells and the normal cells, and we can tell whether the patient is going into toxicity, is having a toxic response, just by the level of the cfDNA, because cancer cells have less cfDNA than normal cells. The technology is called RadTox, and we detect actually a biomarker. There's actually 500,000 copies of this biomarker in the human genome. So it's a very sensitive method for detecting DNA from cancer and humans and normal cells. So we can tell if a patient is getting treated, the cancer cells are dying and the normal cells are not being. So that's the problem with therapy, is that you have a toxic side effects. So we can determine whether the patient is having a toxic effect or not by this test that we've developed. And we measure the circulating free DNA from the patient's blood. And we don't even have to extract it, we just lyse it. And we use a technology called branch DNA, which is a signal amplification technology that amplifies the signal of the gene that we're detecting. So it's a very sensitive method. It's very accurate because we can measure the amount of cfDNA that's being developed by measuring this gene marker that's present in all cells, cancer cells and normal cells. Well, the doctor can adjust. So, for example, if the patient isn't responding, for example, we're getting very low levels of cfDNA, he can increase the dose of therapy by increasing the radiation dose or giving the patient more drugs. So it's a way to monitor the therapy. It's a way to tell the physician how to treat the patient, how sensitive the patient is to the drug or the radiotherapy. No, it's a very straightforward test. It can be run in any hospital lab can run it. And we also have centralized testing labs of our own, CLIA certified, where we can do the testing as well.